What if the town or city you live in could predict your risk of developing dementia? What if your childhood environment and the air you breathed, the food you ate, the education you received, left a lasting imprint on your brain health decades before any symptoms appear? We often think of dementia as a condition tied to age, genetics, or maybe lifestyle choices like exercise or diet. But there's a much larger, lesser-known factor at play: geography. In this in-depth video, we'll explore the global geography of dementia risk, from early life environments to climate, pollution, and healthcare access. You'll discover why dementia isn't just a biological condition, it's a place-based phenomenon. The geography of the mind. Dementia is a progressive neurological condition that impairs memory, thinking, and daily functioning. It affects over 55 million people worldwide, and that number is rising rapidly. But if we map dementia prevalence across the globe, clear patterns emerge. Some regions consistently show higher rates. Others seem mysteriously protected. Why? The answer lies not just in our biology, but in our surroundings. Geography, including where we're born, where we live, and even where we move later in life, has a profound impact on our risk. Rural versus urban divide. One of the most consistent findings in global dementia research is the rural-urban divide. In rural areas, especially in low- and middle-income countries, access to healthcare is limited or delayed. Educational attainment is often lower, especially for women. Social isolation is common. Many elderly live alone or far from children. Physical activity may be higher, but medical care for conditions like hypertension or diabetes, major dementia risk factors, is often lacking. Why this matters? Untreated cardiovascular and metabolic conditions contribute significantly to brain degeneration. But here's the twist: urban areas are not automatically safer. In urban environments, particularly in poorer neighborhoods of wealthy countries, chronic stress levels are high. Sedentary behavior and poor diet are widespread. Pollution levels are significantly elevated. Sleep disorders, depression, and social fragmentation are common. Key point: it's not just where you live, but how you live there. A wealthy rural community with strong education and healthcare may outperform an impoverished urban slum in brain health outcomes. Your first environment matters. Dementia risk begins earlier than most people think, sometimes before birth. Early childhood and adolescent development is a critical period for brain formation. Research shows that children growing up in malnourished environments, underfunded or absent school systems, homes with toxic stress, violence, poverty, instability, exposure to environmental pollutants, are far more likely to experience cognitive decline later in life, even if they move to better environments in adulthood. Case study: individuals born in the American South, regardless of where they live later, are at significantly higher risk of dementia than those born in the North. Why? Early life deprivation impacts what's called cognitive reserve, your brain's ability to resist damage from aging or disease. Key message: dementia prevention doesn't start at 60, it starts at 6 or earlier. The climate and the air you breathe. Your environment shapes your brain, and not just socially or economically, physically too. Sunlight and vitamin D. Low sunlight exposure is associated with vitamin D deficiency, which impairs immune function, mood, and brain metabolism. Populations in higher latitudes, for example, Scandinavia, northern Canada, show higher dementia mortality. Vitamin D is believed to help prevent the buildup of amyloid plaques in the brain, one of the hallmarks of Alzheimer's disease. Air pollution, fine particulate matter, PM 2.5, nitrogen dioxide, and industrial pollutants trigger systemic inflammation, damage blood vessels in the brain, accelerate cognitive decline. Fact: people living near highways, airports, and industrial zones are at significantly higher dementia risk, even after adjusting for income and education. Agricultural chemicals, pesticide and heavy metal exposure in certain farming regions has been linked to neurotoxicity and increased dementia risk in older adults. Key insight: clean air and sunlight aren't just public health luxuries, they're essential for long-term brain health. Inequality and deprivation. Wherever you go in the world, poverty increases dementia risk. But poverty isn't just about money, it's about resources, opportunities, and resilience. People in economically disadvantaged areas are more likely to drop out of school early, experience chronic stress, eat nutrient-poor diets, suffer from untreated medical conditions, live in unsafe or isolated conditions. Even in wealthy countries, there are dementia zones, former industrial towns, aging rural populations, or underserved inner-city communities. Research insight. Some studies show that personal income and education are even more predictive of dementia risk than neighborhood-level factors. Policy implication. Tackling dementia at the population level requires addressing structural inequality. Diagnosis isn't always equal. Here's a hidden factor in the geography of dementia: diagnostic access. In well-resourced areas, early screening is common. Brain imaging is accessible. People get timely diagnoses and support. In under-resourced areas, dementia is often mistaken for just aging. There may be no specialists available. Cultural stigma may prevent families from seeking help. Surprising reality: some regions appear to have low dementia prevalence, but it may simply be undercounted. This is especially true in ethnic minority populations, rural zones, and low-income countries. Call to action. We need more equitable diagnostic infrastructure globally to truly understand and treat dementia. Gender, ethnicity, and education. Dementia risk also intersects with identity. Women live longer and in many regions have had historically less access to education or healthcare, increasing their dementia vulnerability. Ethnic minorities, especially in post-colonial or historically segregated societies, often experience lower educational attainment, higher rates of poverty, less access to quality care. Education is a game changer. Higher educational levels are linked to greater cognitive reserve, which can delay or buffer the symptoms of dementia, even when pathology is present. Key insight: location, identity, and inequality interact. No single factor explains dementia, but geography sits at the center of it all. Lifelong exposure. You are a product of every place you've lived. Dementia risk accumulates across time and across environments. Longitudinal studies now show that people exposed to chronic stress, poor schooling, and pollution over decades carry a higher burden of cognitive decline, even if they live in better conditions later. Bottom line, it is not just where you live at 70, it is where you have lived at 7, 17, and 37. In conclusion, dementia is not just a medical condition. It's a story of society, place, and history. By recognizing geography as a risk factor and an opportunity, we can build smarter public health systems, more equitable diagnostic strategies, healthier communities for future generations. Brain health begins with where we live. Let's build a better world, neighborhood by neighborhood. If you found this video insightful, please like, share, and subscribe to support our mission of creating medical awareness through evidence-based education. Drop a comment below. What environmental or social factors do you think influence brain health where you live? And don't forget to hit the bell icon for future videos on global health, neuroscience, and public health research.